Maintaining proper hygiene isn't just about keeping things looking clean. It plays a critical role in preventing the spread of disease, protecting animal health, and ensuring workplace safety. By the end of this video, you'll understand the different levels of cleaning and how to apply them correctly in practice. There are 3 main levels of cleanliness used in veterinary settings. These are removing gross contamination, cleaning, disinfecting, and sterilisation. Each level serves a different purpose, and it's important to use the right method at the right time. Think of these as steps on a scale, from basic cleaning through to complete elimination of microorganisms. Removing gross contamination is what we most commonly refer to as cleaning. This step involves removing visible dirt and organic materials such as dust, hair, feces, blood, oils, and fats. It is usually carried out using detergents or soaps, along with tools like mops, cloths, and scrubbing brushes. This step is extremely important because disinfectants are much less effective when organic material is present. If this stage is rushed or skipped, harmful microorganisms can remain on surfaces even after disinfectant is applied, which increases the risk of disease transmission. Both mechanical and chemical actions are essential for effective cleaning in a veterinary environment. Mechanical action refers to the physical effort used to remove dirt and organic material, such as scrubbing, wiping, or rinsing a surface. This action helps to lift and remove debris that microorganisms can hide within. Chemical action, on the other hand, refers to the use of cleaning agents such as detergents and disinfectants to break down organic material and destroy microorganisms. These chemicals work by disrupting cell structures and reducing contamination levels on surfaces. For cleaning to be truly effective, both actions must be used together. Mechanical action alone may remove visible dirt, but can leave behind microorganisms, while chemical action alone may not work properly if organic material is still present. This is why thorough physical cleaning, followed by the correct use of chemicals, is essential in preventing the spread of disease. Disinfecting is the next step after cleaning and involves the use of chemical agents that are designed to destroy most microorganisms, including many bacteria and viruses. Disinfectants are applied to surfaces that have already been cleaned and must be left in contact with the surface for a specific period of time to work effectively. This is known as the contact time. It is important to always follow the manufacturer's instructions, including correct dilution rates and whether the product needs to be rinsed off or left to dry. Simply spraying and immediately wiping away a disinfectant may not give it enough time to be effective. A really important point to remember is that disinfectants should never be used on living tissue. These products can be irritating or harmful to skin. When cleaning living tissue, such as an animal's skin, a wound, or even your own hands, you must use an antiseptic instead. A helpful way to remember this is that disinfectants are used on surfaces, while antiseptics are used on skin. Sterilisation is the highest level of cleaning and involves the complete destruction of all microorganisms, including bacteria, viruses, fungi, and spores. This level of cleanliness is essential for any equipment that will be used in surgical or invasive procedures. The most common method used in veterinary practice is autoclaving, which uses high-pressure steam at very high temperatures. Sterilisation is critical because even a small number of remaining microorganisms can lead to serious infections in surgical patients. When cleaning, the method you use is just as important as the products themselves. Cleaning should always be carried out from top to bottom and from back to front. For example, when cleaning a cage, you would begin with the upper surfaces, such as the roof, then move down to the walls, followed by the floor, and finally the door. This approach helps prevent dirt, dust, and microorganisms from falling onto areas that have already been cleaned, ensuring a more effective and efficient process. Even if equipment is expected to be clean, it's important not to assume that it is. You should always check and, if necessary, clean items before using them, especially if you are unsure when they were last cleaned or if they have been sitting unused for a period of time. For example, before placing a cat into a carrier, you should ensure that the carrier is clean and free from debris. The same applies to clipper blades before grooming or any equipment that has been stored in a cupboard. Taking the extra time to check and clean equipment helps maintain high hygiene standards and reduces the risk of contamination.